Nurse Jackie. I was just calling because Sally's blood sugars have been high all day and I'm not sure what to do. Oh yeah, let me ask her. Sally! Come here and check your ketones like Nurse Jackie says.
Ew, gross. Why do I have to check?
I don't know. Let me ask Nurse Jackie. Nurse Jackie, why should we check for ketones?
I'm so glad you asked. Let's dive into the Nurse Jackie fun fact for today. What is a ketone?
Okay, but we don't really have a whole lot of time.
Ew, gross.
Hi, I'm Nurse Jackie. I'm a registered nurse and certified diabetes educator at the Naomi Berrie Diabetes Center in New York City, New York. My patients ask me, what is a ketone, more than any other question. You've probably been told in the past by your doctor or CDE to check for ketones. So why do we want you to pee on a stick so much? And maybe every time you've tested, they've been negative. So let's first talk about what ketones are. Ketones are little molecules of energy that your liver makes when it can't use the sugar in your blood for energy. People without diabetes make ketones all the time when they go a long time without eating or do really intense exercise. However, in someone with type 1 diabetes, ketones can be a bad sign when the blood sugar is very high. So, first, let's talk about how insulin works in the body. So in this picture here, you can see we have the pancreas, your bloodstream, and the cells. Inside of your blood at all times is sugar, right? This sugar needs to go inside of the cell so the cell can use it. Imagine on the outside of every cell is a teeny tiny little door, and that door is normally closed and locked. The key that opens up this door is insulin. So when you inject insulin into the body, those insulin keys go and open that door, allowing the sugar to go inside of the cell so the cell can use it for energy. This is the cell's plan A. That's how it wants to get sugar. When there isn't enough insulin in the body, the blood sugar typically goes high, right? Because we don't have enough keys to open the doors, so the sugar builds up in the blood. The cell still needs energy to do the things that it needs to do, and it can't use plan A because the doors are closed. So the cell says, you know what, let's do plan B. So plan B for this cell is to go over to the body's fat cells instead, break those down and use those for energy. The energy that it gets from fat cells are called ketones. The cell uses these ketones, then they go out through the blood and we pee them out through our urine. Doesn't sound like a bad plan B, right? Like, what's wrong with this? So the dangerous thing that can happen is all of these ketones, when they go into your blood, they make an acid. And this acid is really what's dangerous, not the ketones or the blood sugar, the acid. Once that acid gets into your blood, it makes your whole blood full of acid, which makes your whole body full of acid. We call this an acidotic state. This whole process we call DKA, or diabetic ketoacidosis. The D for diabetes, the K for the ketones, and the A for the acid. We want to try to prevent it from happening, and if it ever starts happening, we want to stop it right away. So to prevent it from happening, what do? You give insulin, right? You give insulin as your doctor has told you to do all the times you're supposed to. As long as those keys are inside of the body, the cell's going to be able to do plan A, and it's going to forget about doing plan B. Then we want to catch it early, right? So to catch it early, we check and see if the body is making ketones. And the easiest place to look is inside of the urine. To check for ketones, you want to pee into a small cup and then dip a ketone stick into that cup. Wait about 20 seconds and compare the color it changes on the side of the bottle. If it stays the same tan color, that's negative. That's a good thing. If it turns trace, it's like a baby pink, that's okay too. A lot of people walk around with trace ketones all the time. If it turns small, it's like a light pink, that's kind of an in-between color. So it might mean that something is brewing or it might be normal. If it turns any of these darker colors, moderate, large, or extra large, that means your body is doing plan B and it's making a lot of ketones. So something bad like DKA might be happening. If you have a high blood sugar with these high levels of ketones, it's important to call your doctor right away. There are two very good reasons to check for ketones. The first is to tell you if you might be going into DKA and you need to speak to your doctor right away, because a high blood sugar with ketones is always a medical emergency. Second, if you wear an insulin pump, the ketones can tell you if your pump is working or not. Have you ever taken off a pump site and seen that the little plastic cannula has been kinked or bent? Or have you ever had it happen where it's leaking and your whole clothes smell like insulin? We call that insulin pump site failure or pump failure, and it can happen randomly, and it always seems to happen at just the worst possible time. A great thing to do to catch pump site failures early before they ruin your whole day is to check for ketones anytime you have a really high blood sugar that makes no sense. There's no reason for it to be that high. Go ahead and check for ketones. If those ketones are higher than trace, it's a good sign that your pump site isn't working and you should change it immediately. One last time that it's a good idea to check for ketones is when you're sick. Anytime you're sick with like a cold or a flu or a stomach bug, what that does is it puts extra locks on the doors of your cells, meaning you need more and more insulin keys just to open it. We call this insulin resistance, and it can be really, really strong when you're sick. So that means being sick places you at a higher risk of DKA. So it's a good idea if you're sick and you're having high blood sugars that aren't coming down, you should check for ketones. So that way you can tell if you're going into DKA and you can call your doctor right away. The big symptoms of DKA include nausea, vomiting, and stomach pain. So if you have any of these symptoms, it's a good idea to check your blood sugar. If it's high, check for ketones because you might be having those symptoms because of DKA. So what happens when I call the doctor like you keep telling me to do, Nurse Jaki? So the first thing the doctor will probably tell you to do is to take insulin. It's very normal for the doctor to tell you to give a little bit more insulin than you usually do, depending on how many ketones you have. Ketones, much like being sick, put locks on the doors of the cells, meaning you need more and more insulin to open the doors and bring down high blood sugars. So often with high levels of ketones, we might tell you to give 50% or even 100% more insulin to bring down the high blood sugar. If you're using an insulin pump, the doctor might tell you to give that insulin via a syringe or an insulin pen with an injection. That's to make double extra sure that that insulin is going into your body so it can stop the ketones from being formed and get the blood sugar down. Second, the doctor will probably tell you to drink water. So since we get rid of the ketones through our urine, we want to get the ketones out faster. The easiest way to pee more is to drink more water. Also, because high blood sugars and ketones make you really dehydrated, so it's really important to drink water. Third, the doctor will probably tell you to relax, aka do no exercise. It usually goes without saying, if your blood sugar is really high and you have ketones, you're not going to want to exercise. But keep it in mind because exercise can actually make ketones a lot worse. Think of it like your cells now need more energy because you're running and they're already doing plan B. So they're just going to go ahead and do plan B even more to get you that energy for running, meaning they're going to keep making more and more ketones. Is there ever a time you shouldn't check for ketones? Yes, you only want to check for ketones when the blood sugar is high. If your blood sugar's under 250 and you've gone a while without eating, your ketones will probably be positive. Just like anyone without diabetes, ketones would be positive if they didn't eat anything for a while. So there you have it. Why do we check for ketones? We check to tell us, is this a regular high blood sugar, or is this a high blood sugar I should be concerned about and call my doctor? Or is this a high blood sugar because my insulin pump is failing? The results of the ketone test are important for your doctor to know A, how much insulin you need, and B, whether you can treat it at home or whether they should send you to the emergency room. Checking ketones is one of the best ways to keep you out of the hospital. It's important to check them sooner rather than later. The sooner you know about positive ketones, the sooner you can call your doctor and treat them, and the better you can keep yourself at home. Thanks for joining me for another fun fact with Nurse Jaki. Make sure you like and subscribe so you can get alerted when there are new fun facts to check out. If you liked this video and you'd like to help us make more great content like this, please consider donating to the Berrie Center. You can find a link in the description where you can go and make a donation. Thank you so much for your support.